Professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
We definitely talk about burnout, self-care. It's definitely challenging to balance, going to school, clinicals, family, working. As psych NPs, we need coping skills to deal with a lot of the heavy and hard things that we see day to day when we're helping our patients. Also, just being a listening ear sometimes and just being there for them and creating some space for them to be able to talk through some of the challenges that they're having can be really valuable. It's important that we address, the work-life balance aspect, which is, obviously it's never going to be perfect, but I definitely ask my mentees, are you doing anything fun this weekend? How's your self-care?
That's great, because sometimes we tend to overstretch ourselves and care for others without filling our own cup. And that's very important, right? Before you can take care of others, you have to make sure that you are full and you are complete by yourself. Thank you for making time. I know with your busy schedule and your amazing boot camps are coming too. So welcome.
Of course. Thanks for having me on.
Yes, and thank you so much for what you do to our community. I know you have some great projects going on too. And congratulations on your appointment as APNA chapter president of Arizona. Yay! Let's salute.
Thank you. I appreciate that.
We're gonna talk about you for this platform and also promote your Psych NP provider boot camps. But first, allow the podcast listeners and also our followers in the social media to get to know you. Can you tell me about your PMHNP journey and who is Dr. Lindsay Hill behind all of these credentials?
I'm Lindsay Hill, as you said, Dr. Morante, and I have been a Psych NP for 10 years now. It's been quite the journey. When I was in nursing school in Ohio, I really did not enjoy my psychiatric nursing clinical, and I did not think that I would ever be working in mental health as a nurse. And I ended up relocating to Arizona after I finished my BSN program. And it was there that I got a job, my first nursing job at Arizona State University as a community health nurse, where I was working with two excellent psychiatric mental health nurse practitioners. And I had never even heard of the role prior to this. And so I thought it was really cool to watch these college students who were seeing these two providers get better. Part of why I didn't like my undergrad rotation was feeling like the patients weren't necessarily able to get the resources they needed to get better. And so it was heavy. It was sad to see. So anyway, it was from there that I decided to go back and that's what I wanted to do pretty quickly. So it was I'd been practicing maybe a year and a half in community health nursing before I decided to go back for my psych NP. And since then, it's been a journey. I worked at the same place for 7 years in community health, and I had a great mentor there. I learned a lot with higher acuity cases, a lot of co-occurring substance use disorders, and I'm really grateful for that experience. And I've had a few other jobs other than that one. And then eventually, about 2 years ago, I decided I'm going to branch out and I'm going to try out entrepreneurship. And that's what I've been doing ever since. I have a private practice here in Arizona and my psych provider boot camp that helps psych NP students and new grads who are needing additional support. That is kind of the common theme that I hear from psych NPs, is that they need additional support. And that's kind of how the boot camp came to be, actually, was just through me deciding to get on social media and networking more, connecting with other psych NPs, hearing some of their pain points, and feeling like, maybe I could help them on a larger scale if I put together a group coaching program. So it's been a journey. And then on a personal note, I live here in Arizona. I have 4 sons, an amazing husband who I definitely could not do like everything that I do business wise without him. He's like the back end and the tech and the software guy. So I'm very grateful for him. And yeah, I like to travel. I like to have fun. I like to do home exchange. That's one of the things that my family does to try to experience new places in an affordable way. So it's a little bit about me personally.
Thank you so much for that one, Lindsay Hill. Once again, we can definitely connect with your nursing journey too. And a lot of listeners will be very interested to know more about your Psych NP provider bootcamp. But before we go over the specific details, I would like to ask you some questions. And this could be professionally and emotionally evocative questions for us as psych providers. The first question is, what was the biggest failure or unexpected challenge you faced while launching your bootcamp, and how did you overcome it?
I would say there was a couple challenges. One of those was overthinking creating the content, because I actually sold my first boot camp and it sold out without having created any content, with the intention of, I'm going to do a lot of this live and kind of it will evolve as I get feedback. But I panicked. Like after it sold out, I was like, oh, now I have to create the content. This is scary. And so just kind of the overthinking on that front was definitely a challenge. And then also the marketing of the product, was not something I was used to doing. And so that was also a challenge. Obviously, people need to be aware of the program to complete it. And so learning how to present that information without feeling too salesy was definitely a new skill for me. So those were some of the challenges when I first launched the boot camp, I would say.
Great. And you were able to overcome those barriers, and now you're topping different types of states and also a lot of PMHNP students across the nation. So it's really great. I'm so proud of you, your growth. And how do you
Thank you.
ensure clinical accuracy and relevance in your content, particularly given the diverse backgrounds and learning needs of your students?
Yeah, that's a great question. Well, first of all, I'm very committed to quality evidence-based resources. Dr. Daniel Carlet's resources, his newsletters, his med fact book, hospital psych fact book, his psychiatric interview book. They really were just so, I couldn't have done it without those resources. And so definitely utilizing those, attending conferences. I'm hoping to go to Harvard's, I think, Precision Psychiatry conference in the fall, and keeping up on the research, using, up to date, open evidence, which is kind of like an AI up to date. I've been using that as well. And then I also bring in content experts from different areas. I definitely don't pretend to know everything, and I have, my areas that I'm really skilled in, but that's not every niche, right? So I definitely try to bring in experts in different areas to provide additional value for my bootcamp members.
I love how you answered this question because as Psych NP, I definitely agree that we are a lifelong learners as providers, right? What
Mhm.
may be true yesterday may not be true in the next few years. So you are evolving as a learner and also as a teacher and educator and mentoring other Psych NP, which is really great.
Yeah.
So some critics view bootcamp as superficial or cookie cutter in nature. How do you respond to those concerns
Mhm.
or bashers?
Yeah, that's a great question. And I would say, Dr. Morante, perhaps, boot camp isn't even the best term for it. Maybe we should be calling it a program because essentially, that is what it is. It's approved for continuing ed. And it's very high touch in terms of the mentorship that I try to provide my boot camp mentees. So we definitely try to avoid that stereotypical kind of cookie cutter approach with the material. And we try to make it really practical too, things that people can apply pretty quickly in their clinical practice, because that's the reality is that psych NPs are getting out, seeing patients and needing tools and skills quickly and support quickly. So that's, the WhatsApp group is a feature of the boot camp that a lot of people enjoy. Um, in terms of getting to hear back from their peers as well as myself. So I would say that.
Right, and I can feel and sense there's like a sense of belonging and also a safe environment for them to be in their boot camp. Right.
Yes, that's a
How do you,
great point.
Great. And how do you support students who may be experiencing emotional or mental burnout, especially during their clinical rotations or post-graduation, or their transition from NP student to being a full-fledged psych NP?
Yeah, absolutely. In the boot camp, we definitely talk about burnout, self-care. I'm really passionate about dialectical behavior therapy because that's what I focused on for my doctoral project. And so we also have a module on that because I really think that as psych NPs, we need coping skills to deal with a lot of the heavy and hard things that we see day to day when we're helping our patients. And also, just being a listening ear sometimes, and just being there for them and creating some space for them to be able to talk through some of the challenges that they're having can be really valuable. So I would say those are some of the ways that I try to support my students, because also I'm also really empathetic to them struggling through school, because I was really struggling through school. It was about halfway through that I realized I think I'm like pretty depressed right now and not doing very well. So it's definitely challenging to balance, going to school, clinicals, family, working. So it's important that we address, the work-life balance aspect, which is, obviously it's never going to be perfect, but I definitely ask my mentees, are you doing anything fun this weekend? How's your self-care? Those kind of questions.
That's great because sometimes we tend to overstretch ourselves and care for others without filling our own cup. And that's very important, right? Before you can take care
Mhm.
of others, you have to make sure that you are whole and you are
Exactly.
complete by yourself. Great job.
Exactly.
And then, what aspects of your PMHNP bootcamp or program do you believe are commonly misunderstood, even by fellow PMHNPs?
Good question. I would say the practicality of it. I think some people feel like they might be signing up for just like another version of school. And I think that they're surprised by all the different avenues that we deliver the curriculum in for different learning styles. So we do different like podcast versions of some of the lecture styles that we do. We have live coaching Q&A. Um, we have self-paced videos. We have digital resources. So we really try to cater to kind of different learning styles that way. And I think that, people kind of expect just more of that, um, just the videos mainly, I think, in the live coaching. And they like that aspect of having these other avenues to to utilize, to learn, because we all learn in such different ways.
That's true. Some are visual, auditory, some are kinesthetic, and some are
Mhm.
basically not wanting a virtual. Are you planning to do this also in person in the future?
I can't see it being in person in the future yet, but never say never. I just did my first in-person event through APNA actually, and it was a lot of fun. And it was great connecting with other psych NPs, in person. So I definitely look for opportunities to try to meet my mentees in person at conferences, or like I'm going to be road tripping through California and the Pacific Northwest this summer. I'll try to meet up with some of my mentees, and I love to network, and relationships are really a huge aspect of what's important to me. So I definitely try to prioritize that.
Great. And in-person connection could be an opportunity for group too, since you can tap different learners, and that will be a good aspect of your program. And then my next question will focus on how do you personally manage imposter syndrome, and what strategies do you offer your students to navigate it?
Yeah, absolutely. I think just talking about, like, acknowledging the fact that we all deal with imposter syndrome, and that it's normal, especially when we're doing something new that we've never done before, something unfamiliar. And so I try to remind myself of that when I'm experiencing those thoughts or feelings. Because I've been experiencing it actually recently, just with the recent collaboration I have going with Dr. Carlat, and the opportunity to co-create a psychiatric interviewing course. That's intimidating with such a esteemed person in the field, right? And so I try to acknowledge it, talk to some of my supporting other psych NPs who just kind of like listen to me and validate me. And, often that helps, just that acknowledgement of, like, that there's not something wrong with me. This is part of it when we're doing something new.
And I'm proud of your collaboration efforts with Dr. Carlot. That means a lot, right?
Yeah,
They show how you work so hard, and I'm glad that you guys collaborated with each other. So
I'm
proud.
excited about it too. Thank you.
And is there a clinical area wherein you still find it challenging? And how do you guide students through similar learning gaps between theory
Mhm.
and practice?
Yeah, absolutely. I have some patients on my caseload right now with pretty treatment resistant OCD. And so part of what I've been doing is really staffing their cases and looking at additional treatment options that maybe we haven't considered. And so for those cases, I've been learning a lot more about TMS and looking at the research on TMS treatment for OCD. And I might even incorporate that into my practice. So we'll see. But I think just, looking at what does evidence-based practice say, and have we really explored all of the different treatment options? Because I think sometimes you get stagnant when you're working with patients for a long time, and you may forget that, oh, I didn't actually try this medication that could be super helpful for this patient, or just a different treatment recommendation, right? So I try to also encourage my mentees by staffing cases. I think staffing cases and, like, doing a case conceptualization helps to acknowledge maybe where the gaps are, or where there's opportunities for improvement in our patient cases.
I love what I'm hearing, and that can also be implemented in school system and also in different settings. And that will be very important if we do like a simulation or case study format, which could be missing in the curriculum of a lot of like secondary programs too. Right?
Exactly.
And the next question is, how do you balance teaching evidence-based practice while fostering the use of clinical intuition and real-world adaptability?
Yeah, that's a great question. I think showing up as a human first for our patients is really important, so that they aren't feeling like they're just a number. At the end of the day, it is hard to seek mental health services. It can be challenging. There can be many barriers that this person's overcome to get this appointment. And so they want to just know that you care about them as a person. I think that's huge. Just letting them know that you care about them as a person, and by your actions, right, and how you conduct yourself. So I think that is huge. Also, really fostering intellectual humility, I think, is important. And just not being afraid to also think outside the box, because we do things off label in psychiatry, right? And as long as we can support what we're doing based on the research, then sometimes we're doing things that don't look just like the textbook, right? That feel kind of uncomfortable. But sometimes we're getting more innovative and creative, and using other treatment strategies to help our patients.
Great. And it's all about patient centricity and also making sure that we are safe, right? So what
Yes.
do you mean by patient-centered care for you as a psych NP?
Patient-centered care for me as a psych NP means that I'm putting them in the driver's seat as far as like being the expert on them. They're the expert on them, as far as like they know their bodies and brains, a lot more than we know them. And I think sometimes there's this power imbalance with patients when they go in and they see a provider where they feel intimidated, or they really want to feel that it's collaborative, right? And that we also value their opinion in treatment and what their goals are for treatment. And it's not just kind of like this provider-patient relationship where the provider's up here just like dictating, like, this is exactly what we're going to do. It's more of a, again, collaborative treatment plan. And so that's how I practice. And what I love about my private practice is I'm able to deliver that. Yeah, I'm also able to provide, I use a HIPAA compliant texting app called Spruce. And so I enjoy that. So my patients know that they can get a hold of me, and sometimes, do some of that asynchronous check-in as appropriate. So just try to put myself in the patient's shoes, and what is good patient care.
That's amazing platform, and I would definitely allow all of my students to know about it. And what ethical dilemmas have you encountered in your role as a PMHNP educator, and how have they influenced your teaching philosophy?
I think, just learning more as I make more connections about industry influenced education, versus kind of education that is free from pharma influence. And I have learned more about that. And, I think it's led me to really respect somebody like Dr. Daniel Carlat, who's remained kind of pharma free with the education that he's provided. And I think that's a big part of why he's such a trusted name. And so it's just made me be a little bit more mindful about those relationships and the nature of the relationships that I'm making with industry, especially if I am going to have an education platform. So
Yeah, I'm so proud of your growth, and
thank
also
you.
tapping different individuals and collaborating with them, like what we're doing right now. Probably we could reach more people, and we build a community, and those community will show support and also be able to create an empire of your PMHNP, which is really great.
Exactly.
And then what role does lifestyle such as sleep, nutrition, and exercise play in your mental health treatment plans?
A huge part. I know Rakesh and Sandra Jan, I believe it's pronounced, Dr. Jan. They have a great book on this. I can't think of the name right now, but it's a huge part of. It should be, in my opinion, a huge part of what we're doing in treatment planning, because basics like sleep really impact somebody's mental health. And sometimes it's so second nature to us, but to our patients, maybe they don't know how much, sleep hygiene and these different things could influence their overall mental health. So I definitely think it's an underutilized treatment, part of treatment that we need to do a better job of addressing. One of the trainings I want to do is like a keto diet. Harvard was just talking about it at their recent conference. And my friend, I wasn't at the Harvard conference, but she was messaging me saying, I want to do this training. It's basically like a very specific protocol that they've used in patients with epilepsy, and they're having good results with clients who have mental health issues. And so that's just an example of kind of looking outside the box for interventions that are non-medication, that could be helpful. I'm also doing the Psychiatry Redefined integrative fellowship that starts this summer. And so I'm always looking at ways to help patients beyond just prescribing medication, right? So that's important to me. I also thought of one other thing from an earlier question when you said, I think you said something to the effect of, with the boot camp, what are people surprised by? And I would say that the fact that they can stay in my community for longer than the 12 weeks. I have people who have been in the community for 2 years and still come to live coaching. And so that is, I think, an added benefit, that they don't have to feel so stressed out about, I have to do it 12 weeks in a row, because sometimes life throws us curveballs, and maybe they have something going on and they want to take more advantage of the live coaching aspects down the line.
That's amazing that they can do that, and thank you for offering that flexibility. And I think a lot of students will definitely be engaged and also connect with that type of platform and program. As a PMHNP, what is your approach to creating a personalized mental health care plan for your patients?
Taking into approach that specific patient's just the comprehensive picture of like what are their risk factors, and being able to identify those, and also provide psychoeducation on what risk factors they have for mental health conditions, because again, sometimes things that are obvious to us, they might not know, right? And also taking into account their physical health, and are there side effects that they definitely, like a hard line, I don't want to have weight gain, and making sure that they know that you're taking that into account when you're selecting whatever medication you're choosing to prescribe, to show that you're, being mindful of their preferences and treatment as well. So I think really just kind of getting to know your patient as a person, and being thorough and looking at more aspects than just psychiatric medication, like you said, exercise, diet, sleep, looking at the whole person.
Right, and non-pharmacological aspects and pharmacological aspects really tied up, like the sum of their benefits are really great or the cumulative effect is really great.
Exactly.
Now we want to talk about also you and get to know you as a provider and also as a person. Can you share a moment when you felt completely helpless as a provider, but stayed with your patient anyway?
Yeah, let me think here for a second. I think probably what I think of is just kind of early on in my career, having a patient that was actively suicidal and not feeling like I knew exactly the protocol that I needed to follow, knowing that, okay, this patient needs more than just like, I can't let this patient leave right now, but I'm also not sure of like how to get them to where they need to be safe. And so, I remember that afternoon, just sitting with that patient for several hours until we were able to kind of navigate through my mentor and different directors, kind of that policy. And so that was stressful, obviously, but I got more comfortable with navigating situations like that, the more experience that I got, and seeing different acuities of suicidal ideation, and more familiar with the resources that I had at my fingertips in terms of getting them sometimes inpatient. So that's what I would say.
Great. And thank you for showing your vulnerability on that particular situation. And as a provider, we are put in a tough situation right now, like, okay, our values and ethics over patient safety, but we always need to make sure that they are the center of our care, which you did. Great.
100%. Thank you.
Was there ever a time you questioned if you could keep doing this work, and what pulled you back?
Yeah, there was a time. It was shortly after I had a traumatic brain injury. I was in a skiing accident, and I was a newer stepmom, a newer mom to my. He's now 5 years old, and so I was in all these new roles, and also I felt like my mental health and my cognitive abilities were not doing so great. And I remember actually telling my friend, uh, I just like don't, I feel like I don't have space for like to hear about other people's problems right now. Like I just feel kind of maxed out. And I did take like a break where I had more creative outlets and just kind of being present, being grounded, being mindful, doing things I enjoyed, hobbies like consigning. I love consigning. I did a lot of consigning during that time, getting into photography. And I did find my way back to kind of how can I do this in a way that aligns and where I'm feeling fulfilled and like I'm making a difference, but also not at the expense of my mental health.
Right? And you were able to go back to your roots and also, I think your big why. What is your big why for entering this type of profession?
Mm-hmm. My faith is really important to me, and just providing hope to other individuals who are struggling is huge. I've had some like very life-shaping experiences dealing with people close to me who have had mental health conditions and even completion of suicide, and it's been challenging. And I've just always wanted to figure out how can I show up more for myself and for my patients in a way that is healthy as far as, healthy coping skills and learning how to navigate complex emotions and, really just help people to have purpose in their lives. That's huge is, us finding that purpose in our lives. And it's huge for our patients too. It's hard when you don't feel like you have that sense of purpose day to day. And it's different for every person what that is, but helping to kind of define that is important to me.
Thank you. And that we are basically coming back to our why. Why are we doing this? And I think it's a deeper passion and purpose in life that we are creating an impact not only to one people's life, but actually the community. And I
Mhm.
love that mental health is slowly getting destigmatized. And also, your role and my role are basically important right now as educators, and also delivering the best care for our patients is really important because I think there is no health without mental health. Do you agree?
Right? Absolutely. Yeah. 100%. It's all tied together, right? So we need to make sure. I've always wondered why we do like an annual physical, but not necessarily like an annual, well check, but not an annual mental well check. I think that would be really cool.
Yes, I definitely agree with you. And I think a lot of medical practices also are now integrating like depression screening tool, anxiety screening tool, which is great. And I think they're more open to incorporating both in
Hmm.
a lot of primary care clinics, which I'm really, really
Yeah,
proud about.
absolutely. Absolutely.
And also, Dr. Lindsay, can you talk about how do you take care of your mental health?
Hmm. Yeah. I have a therapist who I see, who's fantastic. I value relationships. And so I make sure that I'm like attending to the relationships that are most important to me, spending quality time with my husband, my kids. I'm very close with my parents and my siblings. And so spending time with those people who really mean the most to me definitely fills my cup. And so I definitely prioritize that. I try to get sunlight. I try to get, which is pretty easy to do here in Arizona, get outside, not be indoors all day in the dark, try to stay physically active, walking, hiking. We're really into scuba diving too, which is fun. We don't get to do it all the time, but when we have those experiences where we're able to do fun and adventurous things and spontaneous things in nature, that really helps my mental health. And I always love having something to look forward to as far as like a trip or going somewhere. That's always super fun.
Great. So So you guys have heard from Dr. Hill. She's doing the M's of mental health. She's doing movement. She's very active. And another letter M, she's doing meaningful connections with friends and family. And then she's also doing like mindfulness technique that we can incorporate also in our learning in her bootcamp, focusing on the present, not dwelling too much into the past or to the future, and also mastery. She has some hobbies which she mentioned, which is very good. And then
My faith is also important to me, staying involved with my church community and volunteering there where my son goes to his little Sunday school. So that's important to me as well.
That's great, Dr. Hill. You're doing so much for the community, and also thank you for making your mental health also as a priority as a psych NP. And also, can you talk about your TMS experience? I've been following you in your social media, and sorry if I stalk you a little bit because
No, it's great.
very important to talk about this TMS. How was your experience on the
Yeah.
standpoint of being a provider and now you're doing it to have a first
Mhm.
experience? And what was the reason why you did it in the first place?
Yeah. So I decided to check out TMS after I connected with Dr. Robbie Westerman. He's a psych NP who has several TMS machines here in Phoenix, and I had that opportunity. And I was very interested to see, I still struggle with like PMDD symptoms around my luteal phase. So I was very interested to see, could some of those symptoms improve, and maybe could I decrease the utilization of some of the psychiatric medications that I take? And so I also was like skeptical of TMS. I know the research shows that it's helpful and everything like that, but I just kind of like, I really wanted to learn more to be able to speak to it if I was going to be recommending it to patients also. And so my experience has been really, really good. I'm actually probably going to head there after this. But I've had, I believe, like 24 sessions because I've been 8 times, and I do like a theta burst protocol. That's where you do these like 3-minute kind of mini sessions. And I do feel that my mental health has improved. I know that's kind of early to say that, so I'm not sure if it's placebo or what, but I feel overall like my mood's been better than it's normally been during this luteal phase. And I actually haven't even taken my extra dose of Zoloft, which is a strategy that I sometimes use to deal with irritability, mood reactivity, anxiety around that time. So I'm I'm very intrigued. I was just, curious, like how much of this intervention is also like the psychosocial aspect of like getting out of the house. You socialize with your tech a little bit, who you get to know because you're going so frequently. And so I've also been curious about that aspect, but I've been really grateful to get the opportunity to get some exposure to that deep TMS. And I really would love to start offering it as a treatment in my private practice, honestly.
Great. And I think it has gotten a lot more benefits, and a lot of providers are actually adopting it in their clinical
Mhm.
practice, especially here in California. A lot of like PMHNPs are also offering it, which is good. And what's your take about ketamine too? Have you had a first-hand experience about ketamine use or any updates that you want to share with viewers?
I have not. And I do feel, looking at the research, hearing from my peers who have been providing ketamine in different forms, that it's a promising treatment option. I hear that it tends to work pretty quickly to give patients relief. One of the downsides I hear is the duration of how long those symptoms will kind of stay in remission, or that relief will last for. But yeah, absolutely. I'm also intrigued to learn more about that intervention as well, but it's not something that I've firsthand implemented into my private practice yet.
Great. Thank you so much for that update. And for those who are listening to our podcast and viewers, can you tell us about your Psych NP Provider Bootcamp, and if you can invite all of them to join your bootcamp? And thank you for the
Absolutely.
affiliate code that you gave me.
Absolutely. Yeah, I would love for more people to hear about the Psych Provider Bootcamp. It's really a great fit for even family nurse practitioner students or family nurse practitioners who see a lot of patients with mental health issues, as well as physicians assistants who are working in general family practice or psychiatry, and obviously psych NPs as well. So, I think sometimes we leave school kind of wanting more in terms of the clinical experiences that we had, the school experience that we had, just wanting more opportunities to learn and get feedback also on that learning. And so, I think if you're on the fence about it, like one thing I haven't regretted is the investment that I've made in myself for continuing education, mentorship, coaching. Like that's been some of the best investments that I've made, honestly. And honestly, after I had my son, I think that's what was really struggling, is kind of not prioritizing me. And I remember making that pivot to go, I'm going to invest in my growth too. And that's been huge, huge for me to kind of carve out that space. Like, okay, you matter too, Lindsay. You can't just only care about like the needs of your family, or else you're not going to be in a good spot. So anyway, psych provider boot camp. Yeah, I would love it if any of your followers who are interested joined, and we'll get that discount code for them and have the link for them to sign up, and hopefully they can feel more supported, more confident, also more networking connections. I just had my mentee text me before I got on here that she was able to schedule an interview with Dr. Mike Ma. I don't know if you follow him on social media, but that was kind of a networking connection that I had made. And there's those opportunities, I think, the more that you interact with just other people who are in our field and know different people. I think the power of networking cannot be overstated.
Yes, that's very important for all the new grads out here. Connection is everything, right?
Absolutely.
And it will open doors and opportunities for you guys. Dr. Lindsay Hill, what is next for you 5 to 10 years from now? Where do you see yourself?
I see myself doing a lot of what I'm doing now. Like I feel really content in terms of I have a great quality of life. I'm able to spend a lot of time with my family. I would say, hopefully I've done some really amazing things with the Carlac collaboration. Fingers crossed. That would feel really amazing, just to feel like I've had a small part of like helping to get his content out to more people. That's something I'm really passionate about, because I didn't learn about his resources until several years into me practicing, and I was like, I really needed these. So I would say that, and yeah, just really hopefully healthy, healthy family, and just in space to care about the things that matter, and to be able to be, mindful and present in my life day to day is really the most kind of important thing. So
Great, those are exciting projects upcoming, guys. So please watch out for the Psych NP CEO, Dr. Lindsay Hill. She's amazing. Please check out also her LinkedIn, Facebook, and Instagram. And please do not forget to enroll on her Psych NP Provider Bootcamp. I definitely agree that you will be great provider after finishing this bootcamp.
thanks so much, Dr. Morante. I appreciate you having me on, and appreciate everything that you do to support our Psych NP students, new grads, experienced Psych NPs. I think it's really cool to see other Psych NPs doing innovative things. So you've definitely been someone that I've looked to and at to see what is he doing, because it's out of the box, and it's really neat to see what you do to support our people.
Yes, I feel the same way with you. That's why we connected and definitely will be doing some collaboration and more projects. And I want
Absolutely.
our community, our mission together and vision are aligned. So that's why connect with her and make an impact to the PMHNP students that are needing our help. And I think we are the answer to the gap between the theory and the practice and make it all in alignment. Great.
Exactly. 100%.
Dr. Lindsay, and if you could talk to yourself before and now,
Mhm.
without the boot camp and with the boot camp, how do you think you are transitioning or being a provider? How did this help you out through your whole
Mhm.
process?
I would say it's helped me to really make sure I'm staying up to date, because in private practice, it's not as easy to stay up to date on like the new meds because you're not necessarily interacting with like the reps and things like that. And so it's really kind of forced me to go out of my way to make sure I'm holding myself to a standard of like keeping up on what's the research saying. So I would say that. And then I think confidence too, and just like providing care to my patients and knowing that I can help them, I think that does reflect with patients, I think. Not in like an arrogant way, but I just think I think back to when I first started, and I know for a fact, because I got this feedback, that I was kind of like coming off really insecure and uncertain with the recommendations I was making. And I remember a psychiatrist telling me, like, you need to kind of sell them on the plan. Like, you need to be more into it. You sound really uncertain yourself, right? And so I think just increasing that confidence with even different treatment options that maybe not everybody would recommend, or more of an integrative treatment plan. I would say that has helped me be able to do that more effectively.
And what do you hope your patients or students remember you long after they finish their care with you or your Psych NP provider bootcamp?
I hope that they remember just that I genuinely cared. It's funny, this is kind of random ADHD thought, but I know in California they're doing mobile TMS, and when my husband and I heard that, he and I were especially intrigued about like maybe we could do mobile TMS here in Arizona. And like I was saying earlier, some of those treatment-resistant OCD patients I have, like just being able to like even get them into that TMS treatment and maybe get them better outcomes. Like I want people to know that I genuinely care, and I think that would be the biggest thing that I would want to be remembered by is, oh, she was like kind and caring and supported me type thing.
Great. And that will be your legacy. And I strongly believe that you will do great things. And with the support of your husband, Ryan, he's amazing. So shout out
Thank
to
you. Shout out to Ryan. Yep. He's in
behind
here right
every
now.
man
He's
is a woman, and I think
Mhm.
behind every woman is a man. Am I
Yeah,
correct?
yeah. He set me up for this podcast situation. So that helped because I'm not very techie.
Thank you. Any final words, Dr. Hill, for all your followers and also for my followers in Instagram and also different social platforms? Any call for action?
I would say put yourselves out there, even before you feel ready. If you're willing to be visible and share more of your story before you're ready, I really think the impact you can have is that much greater. And I think that it's very out of our comfort zone sometimes to think about doing, but I think that you don't really know how great the opportunities are and just what can happen in terms of helping other people until you kind of step into that. And there are downsides to being visible and being on social media, but I would just say, put yourself out there and make yourself more visible, because I think it will just only help Psych NPs, even as students, to start doing that earlier. And I wish I had started doing that earlier.
Great. And thank you so much for your insights. I greatly appreciate your time and effort and also joining me today. I think we can have more episode 2, episode 3, and more
Absolutely.
Collaboration. And
I love that.
We will definitely do more. So if you guys are watching right now, please feel free to like and subscribe to Dr. Lindsay's social media platform. And we are all in this together.
Absolutely. We are. So it is great.
Dr. Hill, for this opportunity to work with you. And definitely we're going to do more collaborations and projects.
I'm looking forward to it. Thank you so much for having me on. I appreciate it.
Thank you so much.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, Follow us on social media. Until next time, take care.